Today's morning medicine is ginseng. And we all know it as I don't know what everybody knows, but as a tonic for having a better, let's see, where is it? Okay, this is the plant right here. The thing looks a little funny. I should have cleaned off my lens today, but it gets that little red berry, but that's the leaf structure. Now, there's the root structure right here, and that they say looks like a man, so it's good for lower back stuff. Looks like the two legs going up into the hip area. Let's see. American ginseng. No medicinal herb is more famous than ginseng for over 200 years, with American harvested and shipped to the Orient. So we've been shipping it overseas. 95% of the American ginseng crop, wild harvested and cultivated, is shipped to Asia. Interstate commerce of the root is regulated by the federal guys, and it gets you can't illegal to harvest until the roots of the root until the red berries ripen and set seed in late summer, so it reproduces itself. The rhizome at the top of the root, often referred to as the neck, has scars left by each year's leaf stem. The age of the root, which affects its quality and price, is determined by counting the annual leaf scars. Only roots at least 5 years is desirable. Okay, so let's see what it says about American ginseng, the leaflets, all that stuff. Red berry roots considered a demulcent tonic. Anyways, it's a tonic. Research suggests it may increase mental efficiency and physical performance. That's what a lot of people know about ginseng. Aid in adapting to high or low temperatures and stress when taken over an extended time. Ginseng effects is called an adaptogen, which basically tending to return the body to normal. Some caution, large doses may raise the blood pressure. So that's the herbal part of ginseng. It is basically a tonic for stress and energy and all that kind of stuff, mental, physical energy and that. And what they said is an adaptogen, which is it brings your system back to normal. Now, homeopathically, it's the tincture of the root, of course, is what they use. Panax quinquefolia is the one they're using. That is, I don't know if that's American or what. But anyways, the symptoms of the Chinese and the American ginseng are taken together. So they're basically same symptomology, as the two are probably identical. The root is forked like that of the mandrake. The name ginseng is said to signify the resemblance of a man. So that's what the name portrays. A man's thigh or man's thigh. Fabulous prices are per pound are given for it in China. The wild ginseng of Siberia is said to be the best. The natives along the Ussuri River use it to boiled they use it boiled for headaches, colds, fevers, stomach pains. So that's why it says it's an adaptogen which will return the body to normal. In America, it is a domestic remedy for the after pains of labor. So they're using the tincture undoubtedly for after pains of labor. So a woman has a baby, they got all these after pains. Ginseng will help that. Now, I would say homeopathically, and don't forget, all this symptomology is from somebody taking too much of it, and they get these symptoms, and that's how we figure out what it's good for. The shape of the root might indicate an action on the pelvis and lower limbs, and J.H. Henry says it acts on the lower part of the spinal marrow. Is indicated by bruised pains in smaller back, thighs, on rising from the bed. So they get up from the bed, and this whole medicine throughout has bruised pains. That's so whatever's going on, whatever it's from, I would always ask, what's it feel like? Is it throbbing, pounding, and if someone just said bruise, that should lead me right to thinking of ginseng as maybe one of the remedies. And like I say, the hardest part about doing homeopathic medicine is choosing the right medicine, getting the symptoms first off, and then choosing the right medicine. And great Langer, that's why once you get to know homeopathy, how it works, and some of the medicines, you really, just becomes, something where, oh, that looks like that medicine. And our minds are set up to, if we look at clouds, we say, oh, that looks like a face or something. We're set up to understand patterns. Tony Robbins calls it the reticular activating system, which once you never looked at, let's say, red Toyotas. All of a sudden you buy one, now you see them everywhere. That's that reticular activating system, which, once you start learning some of the symptomologies of medicines, someone says something, you say, oh, that sounds like this. Guy the other day is like, oh yeah, man, I had a hip replacement on one side, I need to get another one on the other side. I got pain there. I said, and that I know Aeschylus is good for any lower pains and hips and that. So I said, you ought to try that. So I don't know if he got it yet. Yeah, I know he said he ordered it, but we'll see once he starts taking it if it helps. I don't know if I'll hear from him. And great languor with paralytic rheumatic pains in lower limbs, arthritic swelling of the foot, which had been exerted a long time, violent, so they're using their foot a lot, and then they get this swelling of the foot. And it's an arthritic thing. There's a lot of rheumatism and arthritis with this. Violent pain in the big toe. Henry, another doctor homeopath, also mentions nightly digging in the right lower limb from hip to big toe. So that sounds like a sciatic almost. Cramps, cramp pains from right hip to toes, lacinating tearing in right tarsal joint, the bones of the right foot. And this is a right-sided remedy, it seems. There's a lot of right-sided symptoms. He considered it specific in lumbago, sciatica, and chronic rheumatism, with frequent desire to urinate and sexual excitement. So anyways, the lumbago and sciatica and all that and that rheumatism, there's quite a few medicines that you'd have to consider with ginseng, but that's one of the medicines that you would be considering. So ginseng, stimulant to the secretion glands, secretory glands. So the glands that secrete, your mouth and your, nose, any of those glands, the parotoid glands, the mesenteric glands in the jaw, those ones would, it stimulates them, which that mucus, if you have dry mouth all the time now, a lot of people, if you take these drugs, it dries your mouth out, whatever it is, Benadryl, any of them. Anything that dries your mouth out is worse for your teeth and your microbiome in your mouth. So you really need to be careful when you're having too much dry mouth. And drinking a lot of times doesn't repair that. Lumbago, that's a 3. Sciatica is a 3, and rheumatism's a 3. They got hiccups, so they're hiccuping, and as you'll see, the digestive system is messed up, causing them to have the hiccups. The ileocecal valve that stops the bacteria from backing up into the intestines is not working right. There's a few things going on down there. So they'll know, as you'll see in the abdomen, they'll have rumbling and gas and distension of the abdomen because of the problem in the stomach. Paralytic weakness, skin symptoms. So yeah, this paralytic weakness can be any parts, the lower part especially, because of the way the root looks. And that root looking like a man with legs and that is called the doctrine of signatures. That's what I say. When they look at something, when the eclectics, the alchemists, the herbalists, and that, they look at something, they think, oh, or they cut, like there's one called bloodroot, and you cut it and it looks like blood coming out of the root. It's red, and that's good for your blood. So yeah, it's basically a doctrine of signatures there. So paralytic weakness would most likely be a lot in the lower limbs and that, but it can be in the upper. Skin symptoms, respiratory organs are affected, mouth and throat is dry in that. They're having problems in their mouth and throat, hard time, the breathing in that is a problem, and the skin has different problems, as you'll see when I get to the skin. There's not much on the skin. Better at dinner, so better when after they eat dinner. Worse in open air, even when they're in the room, the air that they're breathing in affects the, feels bad in the throat. It just doesn't feel right. Uh, talking, worse at night, worse bending and turning. This bending and turning, of course, is obviously the hips and the legs and the back and all that. But they can't talk. Worse at night, worse in open air, and better after they eat dinner, basically. I don't, it doesn't say breakfast or nothing. Worse, descending stairs and sitting. So this is all bending, turning, descending stairs, sitting, most likely all the limbs and the back, lower back, and all that. So that's basically the doctrine of signatures again. You're having a lot of lower, and this could be the guy that I said was needing a hip and had a hip pain. Aeschylus, it could be ginseng. So there's a few. You have to, I would have to sit down and ask him questions. But right off the top of my head, I thought, try Aeschylus. You never know. I gave it to a lady when I was doing her marble years ago. And it had to be 20, 30 years ago. And she was in a wheelchair. And I asked her if she'd take a medicine. What's wrong? She told me. And she didn't say hip replacement or nothing, but she told me, and she said, I said, would you be willing to take a medicine? And, natural medicine, So I gave her a bottle of water with a little sugar tablets of Aeschylus in it, pounded it 100 times, gave it to her, told her to pound it 10 times that day. She pounded it that day, and before she went to bed, 15 minutes after you brush your teeth, take another dose. And when she woke up, when I got there, I guess, 8, 9 o'clock in the morning to start on her marble again. She was standing out of her wheelchair and said, "My God, what'd you give to me?" So, it just confirms the fact of how these little sugar tablets that have nothing in it but energy. And this energy nullifies, causes the vital force to rise up, is the way I think of it. But that energy nullifies the energy of the sickness, disease, injury, whatever it is. Hahnemann talks about where the disease is actually a spirit-like thing that affects your vital force. So it's an energy, So a hit is like boom, if you hear a bell, you hit a bell and it rings. Well, that's what happens when you get a hit. You have a car accident. It's like bang, someone, and they always say they rang, he hit him, punched him or something. He rang his bell, So it's like a ringing of the bell, and that affects your vital force. And he says only another energy can come in and get rid of it. And what they in the Organon, his treatise that he wrote, um, he talks about like measles, cowpox, and what was the other one? Measles, cowpox, and whooping cough. So he says someone that has measles, when the whooping cough comes around, they don't seem to get it. It basically, once the measles runs its course, that whooping cough, if it was in that family, and it doesn't affect them, because the energies, it's a similar energy. Whooping cough and measles did the same, affected basically the same organs and the same systems. And anytime it's similar like that, it basically nullifies it. And that's what homeopathy does. It nullifies the symptomology of something, because the energy of the medicine, when you hit it, you get the right energy. That's why the potencies are 6, 1C, 2C, all the way up to 200, 1M, 10M, 50M. You get the right energy, and that supersedes or nullifies the energy of the disease, and that's how it cures. So I just think that's so interesting how they discovered that, and that only came from him um, doing an experiment on himself with the cicona bark, taking it until he got poisoned, like they do with every medicine, to figure out the symptoms. And when he did that, he realized, oh, that's why it's curing, because it has a similar energy as the disease of malaria. And so that's why it's curing. Now I take it as a healthy person and I get malaria symptoms. Yeah, that's wild that he was able to uh, deduce that from that situation. So They're quiet, contented, good courage, weak memory though. Weeps, anxious about the future, fear of accidents. So there's a lot of fear with this. Even though they're quiet and contented, they're not overly excited or anything. They have courage, but they do have this fear of the future and fear of accidents. And they can weep. Pulsatilla is a weepy medicine, basically. Tense in the abdomen, painful, and rumbling. So a lot of gas. And that's why I say it's like the ileocecal valve that's not working right. Pain on right side, tension and inflation. Now, do I need to know that the ileocecal valve is not working? Just like that, my cousin said, I've got a hiatal hernia. I looked at my books and it's like there's nothing in there that says about hiatal hernia. Well, it's just that valve's not closing. They're calling it a hernia. Um, Anyways, heartburn and throwing up because the valve is not working. They said there's a tear in it. She's going to get surgery, but pulsatilla, which is that weepy medicine, I gave it to her, and she said she hasn't thrown up and she doesn't have the heartburn, but she's still going to get it repaired. And there's a major recovery after that. So, yeah, I don't thought two things. Either while she's taking the pulsatilla, I could give her calendula. Calendula will heal any wounds, internally, externally. She'd have to take it homeopathically, of course. She could actually, yeah. Anyways, but topically, I put it on my kid's leg, calendula, and boy, that just. I took them back to the doctors because they sewed it shut. It got infected. They had to open it up because it was too deep. Keep putting this gauze in there. So I was putting calendula on while I was putting I put the calendula on the gauze, put it in there. Next day or so, I'd pull it out, clean it, and then put more calendula on and put another cotton ball in there and tape it up. But yeah, I took them back to the doctor. They said, "Boy, I don't know what you're doing, but this is healing amazingly fast." So same thing. I would tell her to take calendula now to repair that valve. So let's see, tense, painful, tension and inflation. Uh, that's it. So inflation, they got a lot of grumbling and grumbling. They call it borborygmi, which is in my, the introduction to this. But there's a lot of gas and stuff going on. Stiffness in the back, and stiffness also in the back and the nape of the neck. Pressure in the dorsal vertebrae. Coldness in the back. Neck cracks. On any movement, the neck cracks. So they move their head and their neck cracks. You would consider ginseng. Lacinations in the loins and between shoulder blades. So this is like a cutting pain down in the loins and up in the shoulder blades. And I don't doubt it's mainly the right shoulder. Aching and oppression in the chest, dyspnea, which means they can't get their breath. Anxiety in the pits of the stomach and lumbar. So this anxiety in the pit in the stomach, which you'll see on the stomach, drawing like hungry, lacinations in the right side stops respiration. So that's why it's pits of the stomachs over here, because it's that pains in the stomach is called, and they say anxiety there. So this fear in that they got going on from the gives them that anxiety, and then they got these cutting pains, which uh, uh, causes their breathing not to be so good. That's why they get that dyspnea. Prostration of strength and lassitude of limbs. So when they took this, they got, they overdosed on it. They've got this, they got real weak, and of course their memory and all that got weak. But that told them from overdosing on it that it would be good for somebody who had a weak memory or lassitude of the limbs and prostration of strength. It would increase it, taken in proper doses, or somebody that has that, they would take that medicine. It would take care of that lassitude of limbs, prostration of strength, memory weak, weeping, and all that. It would all normalize that. Pressure in the eyes, difficulty opening lids, which are heavy and painful. Vision is indistinct, sensation of fatigue when exposed to light. And they have a lot of itching in their eyes. So the eyes are itchy, they're heavy, they can't take the light. They just feel tired when they see the light. They can't make out visions, especially reading and that. And there's pressure there. So this, even gelsemium sounds like that. You see a gelsemium patient, they have lassitude, they're tired, their eyes are droopy, and that's a big one. You see their eyes are all they're just like, oh, I'm droopy, and whether it's a cold, a flu, an injury, whatever it is, you would consider, oh, that looks like gelsemium, but now also ginseng would be in there. Uh, Face alternates pale and red, so they can be pale 1 minute, red the next. Burning sensation in the face, redness in the right cheek. There's that right-sided part of this medicine. Nose, chin, lips, they're all red and dry. Rough. Wait a minute, that's the other one. Okay, drawing in jawbones, though. There's like a drawing pain in the jawbones. No female, no food. Head feels enlarged and sways to one side. So it turns to one side for whatever reason. Pressure in longitudinal sinuses. So the sinuses have pressure. Drawing pain. So they sound like they might, this could be anything. This could be a cold, a flu, a allergy, whatever it is. They've got, and I don't know why, longitudinal sinuses, but drawing pains, one-sided head pain. So most likely the right side, I wouldn't doubt. Lacinations in the right side of the forehead. Yeah, so it's right-sided. As far as the orbits, in the right side of the forehead, as far as the orbits with heavy eyelids. That's why I say that heavy eyelids is a definite gelsemian sign that you'd be considering along with ginseng. But the right-sided forehead, it goes right into the eyes, that pain. Lacinations again. So it's always like a cutting pain, no matter if it's in the abdomen, in the eyes, or in the forehead and that. Heavy, sudden shock in the occiput, like a bruise. So they feel like there's a bruise all of a sudden in the, and there's a lot of this bruising feeling in the, with this medicine, whether it's the limbs or the, like it said here, the occiput, there's a lot of bruising with this. Severe cutting pain, like a dagger in the heart, in the precordia region. So yeah, there's like and this is that lacinations. There's like a lacination in the heart area. Pulse is irregular with violent beats. So there you got this violent pounding of the heart. Sticking in voluptuous itching and fossa. That's the urinary tract area. Pruritus, the fossa, that's the, anyways, I'm not going to get in what the fossa is. Pruritus, which is itching and burning in the urethra with urge to urinate. They have yellow urine with red sediment. So these are the things I'd be looking for. Yellow urine, red sediment, burning, itching, and they're always having to go. This itching in the fossa, that doesn't matter. There's itching down there. It's voluptuous itching. So I'll be looking for one side of the head feels sways that enlarged and sways to one side. These kind of things would help me to get to a medicine, whether I know if the ilioceliac thing is working or anything yeah, I don't need tests. I just need to talk to the person and find out what's going on, and then I can usually pinpoint which medicine they would need. And you can do the same too. It's not that difficult. Hands feel swollen. I remember when I first started, I was just like, I basically would just uh I would go to these books, the repertory and the materia medica. I would go to them and I would look and I would say, oh, here's what I got going on. Look under the head if it's a headache. Look under this and that. And then eventually I started knowing some of the modalities or some of the keynotes of these medicines, like arsenicum's burning, cantharus is burning, gelsemium is, just laying there, dopey, tired, that kind of stuff. So, uh, where am I at? Hands feel swollen, burning heat in fingertips, stiff, contracted joints. This sounds like Russ talks. There's a lot of stiffness with this and much cracking on moving. What is that? Graffitis has a lot of cracking. Bruised pain in small of back and thighs. So there's that bruised pain again. But stiffness is a big one with this. Stiffness, bruisedness, lacinating pains. What else? Weakness, paralytic weakness, all that kind of stuff. Okay, so heaviness in the lower limbs with bruised pain moving to different parts. So this sounds like pulsatilla. With that weeping, I would be considering pulsatilla with this medicine, but the pains will be in the knee, then it'll be in the shoulder, then it'll be here and there. So that's what happens big time with pulsatilla, along with weeping with pulsatilla. But this one has it also. Lungs, no liver, lungs. Voice is rough and hoarse. Dry cough in paroxysms. So it's like paroxysm. It just bum 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 bum. It just comes on. It's not a continual cough or just a one cough thing. They have paroxysms when they do it. But it's a dry cough. There's no mucus going on. And the horse, they got a hoarse voice. Short, anxious respiration with exertion. Now, the reason why they're probably being breathing like that is because they have that lacerating pain in the stomach that causes their breath to be painful to breathe. This deep inspiration and tightness in chest can't get enough air, so that's that dyspnea. They just can't get the air they want. Better walking, so they got to get up and walk around. They got to get the open air is worse for them, but they got to get up and walk and try to get that oxygen into them. Con- Contractive pain across lower thorax. So yeah, this is the lower pains again. And there's a lot of contraction, drawing pains, and yeah, so all right, let's keep going. Rheumatic pains after frequent emissions. So anytime you're losing, they call it uh, never well since vital loss of vital fluid. So anytime you have, whether it's semen coming out of you, sinuses, a lot of mucus, sweat, um, bleeding like menses and leukorrhea, any of the liquids coming out of you will weaken you. So that's why, and then you'll notice you'll have rheumatic pains. Someone has a lot of sex, you know they will have back pains basically. But these rheumatic pains will come on because you're weakening your whole system by draining you of your vital fluids. Anytime you have these vital fluids leaving you, you want to replenish them. And that's why they used to have, 100 years ago, they used to bleed you. So, and that's what they were talking about. I was reading Organon, and that's what he was talking about. These um, one disease will, a disease. So in other words, when I have a cold, if I have joint pains, I used to have rheumatism or pains from my work and my rheumatism. When I would get a cold, I wouldn't feel them pains. So it kind of overrode it until that cold went away. Then the pains came back. So that's kind of the same thing, when you bleed somebody. Oh, we cured it. No, no, you didn't. Now the vital force is focused on something more important. The blood's lost, man. We gotta take care of the body. We don't have enough blood going on. It's been lost. And it seems like the body quits focusing on whatever disease they were trying to cure with that. So same thing happens with the drugs. You have a headache, you throw an aspirin in. That drug supersedes the headache. It does its trick, but your headache will come back eventually. Whereas you get the right medicine, the homeopathic medicine, it'll cure it. And then, of course, you most likely got to change some things you're doing in your life, whether it's stress, the food you eat, whatever's going on. Weak genital organs. Oh, this is all male. Yeah, I put the male in the wrong spot. Rheumatic pains after frequent emissions, weak genital organs, sexual excitement, pressure in the testicles, nocturnal erections with pollutions. So they have wet dreams, is what that is. Painful erections while sitting. All right, so tongue is red and smarting in the mouth with thirst, white, dry. The tongue is white. They have a lot of thirst, red and smarting, and dry. Voice is rough, scraping, and they have green saliva. That's very interesting. And it's worse swallowing the saliva. So when you have a cold, flu, whatever, and they can't even swallow the saliva, you would consider ginseng. Evacuation is difficult for the rectum. They have hard stools, so this is constipation, followed by burning in the anus. So there is a lot of burning with this medicine too. Where was the burning? There was other burnings. Burning. I've seen it. Burning. Okay, anyways. Sticking in the anus. Tenesmus, like they're never finished. That's what that means. Violent pain to pelvis and thighs. And this is obviously coming from the rectum. Itching pimples on the neck and chest. So whatever reason they've got, this is the only skin stuff. Itching under right foot. So this is so unusual that, yeah, I don't know if there's any other medicines that have that, but that would lead me right to ginseng. And that's sometimes all you need is one symptom that's like, oh, I know what the medicine that is. Lasciviousness in their dreams. That's where that wet dreams are coming out. Yawning, drowsiness, difficulty waking in the morning. So a lot of yawning and drowsiness, and then lascivious dreams, which they remember when they wake up, and they have difficulty waking. Obviously, they're not sleeping well, or they sleep too good. Pressure, oppression, and don't forget, this is when they overdosed on this. This is where they got the symptoms. Pressure and oppression of the stomach. Pressure of the clothes are intolerable. Lachesis has that. Lachesis is snake. They don't like clothes around the neck. That's a big symptom. If someone said, "Oh man, I just can't take this around my neck," even if it's a light clothing around the neck, you would consider right away lachesis. Now I'd be considering ginseng when they can't take there's a few of them that has the clothes, can't take the clothes on the skin. Or around the stomach is what it is. Contractive drawing, like hungry. So there's that contraction and that drawing again. Lacinations on the right side stops respiration. That's what I was talking about, the breathing. Temperature, they have coldness, numbness, trembling of the hands, chilliness through the back to the arms. Coldness extends to bones. Eupatorium purr would be good for that, of back. In the throat, they have tonsillitis, like belladonna. Belladonna, ginseng, there's a few other ones for this tonsillitis. And that would be, was the mouth, I think it was redness, voice, hoarse, dry cough, redness in the mouth. Pollutions, where is that mouth? Oh, red, smarting, yeah. So there's that red smartiness and then tonsillitis. You'll have even, I think there's white spots with tonsillitis in dark complected people. So this tonsillitis, and if they're a dark complected person, ginseng, you'd be surprised how being a light color, like a blonde or a light color complexion person, or compared to a dark complected person, would lead you to different remedies. That's very interesting. That's how particular homeopathic medicine is. It isn't like you got a headache, here's an aspirin. You got a headache, I got 100 medicines. Okay, let's figure out which one's yours. You're a dark-haired person. Oh, you even look at you're more heavy set. More heavy set is like calcarb and stuff. Thinner persons is sulfur, different things like that. So there's all kinds of things. You just see a person coming in, you think, oh, that looks like this person. But then you have to take the symptoms to see what's going on. You may need a couple medicines before you get down to that constitutional remedy, which is, everybody, we all are born with a constitutional state. Cloudiness, confusion, giddiness in people with vertigo, and heaviness of head. Gray spots before the eyes. Objects appear double, so they'll have double vision, gray spots, dizziness, the confusion, they're giddy, they're laughing, all that kind of stuff. So, okay. And there's, where's that? Where's the end of ginseng? I think there's some reading. Nope, no reading for ginseng. Oh, I'm over anyways. Okay, you'd consider coca, which is cocaine. Hedra for depression. Hedra, I forget what the rest of that is. And skin irritation, antidoted by gunpowder. We do make a medicine out of gunpowder. It's a good medicine. In drowsiness with headache, brucea, I can't remember that, and gelsemium, that's what I was saying. Gelsemium has that drowsiness with headache. Nat Sulph has it, but that Nat Sulph would be more like a head injury. That's usually what it is. But even Nat Sulph and any other thing would be considered. But gelsemium with that drowsiness, that droopy eyes with the headache. Nux muscata, what is that? That's It's a Christmas. You put it in your Christmas drink. Nutmeg, yeah. Nux muscata and sulfur in dry lips. So dry lips, you would consider ginseng, nux muscata, and sulfur, and bryonia is another medicine you would consider with ginseng. And as usual, you can age, but you don't have to get old. Depends on how you treat yourself, your stress levels, your food you eat, and your movement in life.